Hi guys, this is Tony Chang Med. Welcome back to the channel. Today I'm talking to Dr. Wil Caruso. He just graduated from Medical College of Georgia down in Augusta. He's a Georgia boy just like me, and when I learned that he was from Georgia, I knew I had to reach out to him. He got his bachelor's in biochemistry. As a pre-med, he started the pre-med community, which is an online resource for students who want to apply to medical school. He's made lots of content on social media, including Instagram, YouTube, and TikTok. He's just super funny, super relatable, and just from everything I've seen, he just seems really down to earth. He just matched general surgery, and today I wanted to celebrate that by focusing on his match experience and his preparation for residency.
Awesome, dude. Thank you for the introduction. I look forward to talking to you about it.
Yeah, of course. How are you today?
I'm doing pretty good. Pretty good. How about you?
I'm doing great. Match was like really recent for you, right? Was that like a week ago?
It was about like, let's see, it's May now, so like 2 months ago.
2 months ago. Okay. I just saw the video more recently. I saw like, oh no, those are your graduation videos when you were quizzing all the
Yeah.
classmates.
So,
How did they feel
um,
about that?
well, it's kind of surreal, honestly. People are calling me doctor now, and I'm still like, am I actually a doctor yet? I'm like, I guess technically I am, but in my mind, I'm still in the medical student mindset. So it's gonna take a little bit of adjusting to like, embrace that title. So.
Yeah, that's actually one of the questions I had. I just finished my first year in med school, and they just kind of throw a lot of things at you, and they kind of, at least my school, they put you in the clinic a little bit early, and I feel kind of lost a lot just because it's my first year. I'm like barely touching the tip of the iceberg. Um, was there a point in med school when you felt like you were ready to be a resident?
Actually, I can say that there was like I don't know when, but at some point I was like, you know what, this stuff kind of like is starting to like make sense. It's kind of like starting to come together. Because I feel like as a first year and like second year med student, it's like you're just learning a bunch of information. It's just like all over the place. Like here's the GI system, by the way. Oh, here's the heart, here's the lungs, and oh yeah, here's pharmacology, here's microbiology. And you're just like, whoa, okay, like this stuff is like there's so many it feels like random facts, like they're kind of thrown at you just so much at once, right? And then third year medical school, it's like, okay, you're in OB-GYN right now, and you're learning about these aspects of like OB-GYN. And then you're like in family medicine, you're learning about these aspects of things. And I think at some point after enough like rotations and studying for step 2 CK definitely helps kind of like take all the information and kind of make sense of it. It just kind of clicks and you're like, oh, okay, just like I kind of know in general like the workflow of being a doctor, like how you like, look at a patient, look at their past medical history, you kind of see how it all relates. Oh, because they have these past medical history and comorbidities, I got to be watching out for these things, and I have to care about like using these drugs on them. It will all click. I think for me it kind of clicked maybe like midway through fourth year, I'd say.
Okay, well, that's something to look forward to. Like, I can't wait till it starts to click for me. I'm
Yeah, it'll
seeing like all the
happen.
pieces come together, like learning, I think, cardio and lung, and just seeing how the systems start to work together. So I'm looking forward to it.
Yeah,
Um,
definitely.
so what got you into the social media sphere?
Honestly, that was more just like I was just messing around with social media like back in 2019. I didn't really think too much of it. So like I'd say like at the very end of 2019, probably the beginning of 2020, right around like when the pandemic started, I think like I kind of just messed around with it. But then like I posted more and more, and then some people like send you like nice messages like, "Oh, thank you for this. This content was helpful." And I think that kind of like motivated me to like do a little bit more. And then like the more you do, some more people are like, "Oh, I appreciate you posting about this and stuff like that." So I think honestly it's the people that kind of like funneled me down to like going, okay, I want to do more and more and more. And I was like, yeah, I kind of enjoyed, helping people and trying to provide some content that someone would enjoy. So I honestly have to thank the people, I guess, for kind of getting me down here.
That's awesome. What's kind of been like the biggest feedback that you've gotten through your social media, I guess, experiences? Like, what's something that someone told you that's been like really motivating for you?
I think like when people just like say like, they're inspired by like what I'm doing or inspired by like, the story or the message that I put out, like, it's like, oh, I'm a pre-med student, like I've read some of your stuff and it's like inspiring, or like I want to also do what you're doing, and like I just appreciate you for sharing that. It's helped me on my journey and stuff like that. Whenever I get comments like that, it just kind of like reminds me, I'm like, yeah, there's a rhyme and reason to why, we're doing this.
It's awesome. Yeah, like just starting to make this content in this past year, I don't have a huge following right now, but like when I hear people, when I share something and then someone else says, "Hey, I'm actually feeling that way too," or am I having like similar experiences?
Exactly.
That makes me feel like, I'm getting people's voices out there who aren't typically being heard or don't feel like sharing.
Yeah, exactly. And like someone who might resonate with me, someone might resonate better with you too. So I mean, it's like it's good that we have multiple different people who are, I guess, doing kind of similar things, because your perspective might really resonate well with someone that maybe mine didn't as much. So I mean, you get to impact people differently than I would or someone else would. So I think that's a great thing. We have a lot of different people in the same sphere.
Awesome. Um, so I wanted to ask you, just because general surgery is like, it's along the lines of those like more competitive specialties. Was research a big part of your medical school experience in terms of like getting that competitiveness?
So I'd actually say my me matching the general surgery is kind of like, I would say I'm more of an outlier than the normal people, because I actually originally applied 3 different specialties. Fun fact, which I wouldn't necessarily recommend. It was not like I'm choosing 3 different specialties because this is the ideal thing to do. It was kind of because like I had different reasons for each of them, and I had a hard time like really like solidifying them. I had like, oh, I like this for this, this for this. And then also I realized kind of late in the game, like one of the specialties might not be what I wanted to do. So I kind of had to like almost like last minute, like go back to the other thing that I really was feeling.
Mm,
So I was actually originally an emergency medicine, declared student up until like a few months before match day. And I just felt within me, I was like, I miss the operating room. And like that's really where like I constantly keep thinking about. And I try to push that thought off for as long as I can. I'm like, it's too late. I'm already like a 4th year. I'm already EM declared. I didn't ask for letters of rec from my surgeon people. Like I don't have a chance of getting into surgery. So I kind of like was always upset at myself for not like pursuing this, because in my heart I really wanted to be in the operating room. And one day I just finally like decided. I think it was like I was in the ER, and a trauma came in, and I was like, oh, it's so cool. And then I see the surgeons come in and they take them off to the OR, and I just remember like, oh, I really want to follow them, and I want to see like what they're doing with this person. But I'm stuck in the ER now just thinking about that the whole time. I think it was at that point I had to call my advisor, and it was like, I don't know how to say it. I know it's like a month or two from like, it's like 2 months from match at most. But I really want to like switch to like, general surgery. And we had to make a lot of calls and like really switch up, rotate, and get myself a rotation. Like literally I had a rotation like as like match the ERAS application opened up. So like
gosh.
just in time, like in the nick of time, like I had to get that. But
How
I
did your
did.
advisor respond to you almost doing like a 180 essentially?
Well, I've actually talked to him a few times in the past. I've tickled with the idea with him. I was just kind of like, because he would talk to me about it, and I'd sometimes say it's like, there's a part of me that really wants to like, go to the operating room, and he's like, yeah, it's up to you, man, and stuff. So I finally kind of was like, I really want it. And also it helped that he was a general surgeon before too, so
That kind of
I think
helps.
probably helped a bit because he had the connections with some people at the school. But then also, I mean, like, of course, he's gonna like probably support me wanting to go into his field. So I mean, he was honestly he's a great advisor, because he was just like, this is your journey. Like I'm supposed to like help you do what is best. Um, I'd say my step scores were enough to get to general surgery too, so it wasn't like completely out of the realm of possibility. Like he wouldn't have recommended me to it if like I had 0 chance or something. I think really what I was missing was, so as in going back to the original question, I was emergency medicine declared. So I didn't have really much research. I actually, luckily, I did do a little bit of research just on the off chance that I might need some, but I didn't get publications or anything like that, because in ER, you don't need research at all. Like it's all about like the slow, like a standard letter of evaluation. That is like the only thing that matters in like emergency medicine, like residency and stuff. So I was so EM declared till 4th year, I didn't really have like publications, research, and stuff like that. I did have one thing, but like not much compared to most people. So I definitely felt like at a disadvantage for general surgery. But what I can say did help me, because I would say I'm an outlier for general surgery. I think my personal statement was really good, because actually I had the people who, accepted me said like your personal statement was like really, really good. And like that really stood out to them. So like I think that was like the first thing that like helped me with that. I did end up getting all the letters of rec I needed for general surgery with that rotation I did last minute. And then I also like messaged the people who I did the original like third year rotations and stuff with. So I got some letters from them, and then from the people who I was doing a rotation with at the time. So I had enough letters of rec. My personal statement was good. And then also another factor that people don't, I think, consider is like, are you going to a community hospital or like more of an academic one? With the academic thing, it's going to be hard because I just didn't have time to get like the extra research in. So the place that I'm doing residency at, it's more of like a community-based hospital, and it kind of serves, I guess. Well, you're from Georgia. It serves Gainesville, Georgia.
Oh yeah,
So
I'm familiar.
right. So it's not like Emory or something where it's like research is kind of like, a must. But what they did like was I chose to do my rotations in a more rural location in Georgia, like Albany, Georgia, Valdosta, LaGrange and stuff. And they liked that because like it kind of like went in line with my personal statement and also with their mission as a hospital too. So they want to serve people in like I guess like more underserved type of places. So I just say like don't underestimate the power of your story. Of course you have to have a certain level of step grades and clinical grades and stuff, but research is not, it is pretty important, but if you have a good story that can still like I guess like be good enough to make up for that. So,
Gotcha.
yeah.
Wow, that's really cool. Yeah, I watched your three specialties, and I met like your match day vlog
Okay.
recently. Can I ask you what the third specialty was?
Yeah, it was anesthesiology actually.
Anesthesiology. Cool.
Yeah, so reason for anesthesiology was it's kind of like a hybrid almost. So it's still in the operating room, but it still had aspects of emergency medicine like intubations, putting in lines. Like I knew for a fact that something I wanted to do was like procedural based. Like I know for a fact, like I just couldn't stand like staying in like the family medicine office and just like prescribing like, high blood pressure meds and like doing that over and over. Like to me, like I couldn't find myself engaged enough. And I know there's some people who do. That's just not me. But like I felt most engaged when I was like hands-on, whether it's in the ER during a trauma or it's in like the operating room, just holding open something. I knew for sure it had to be a hands-on thing. And I was like, okay, if I can't get into surgery, maybe I can get in anesthesiology because that's also in the operating room, and I'd be pretty happy with that.
Yeah. When was like the first time you scrubbed in? I recently scrubbed in for surgery, and they asked me to hold something in the OR, and I just felt like, whoa, like a massive responsibility,
Yeah.
standing in place, making sure it's held open. Like that just was a huge feeling that I guess like a lot of students in medicine, like they get that overwhelming like first feeling, that wave of, oh wow, I'm in the OR, and but you're just sitting there just holding one thing still. What was your first time in scrubbing in?
So actually my first experience was not in surgery, it was actually an OB-GYN. So my first clinical rotation was an OB-GYN rotation. And I got to scrub in for like a C-section. So that was actually really cool. He actually like kind of lets I guess it depends on the preceptor and like how much they let you do, but like I was pretty involved with like, holding open and like helping like a baby come out of someone. So I was like, this is pretty cool. And I think just the same way you said, like, just being in the OR is such a, just I don't know how to explain it. It's such a surreal experience, It's just like you enter another like dimension, It's just like it's quiet, it's cold, it's focused, it's serious. It's just a really cool environment, And just holding open, something feels like you are doing something really, really important. You could just literally be, exposing, the spot for the surgeon, but you're like, my life depends on this. I will not let go. I will not move my hand. This hand stays put. And I just think that was like, just doing that, I already felt so cool. And I was like, this is really cool. I can't imagine like how cool it's gonna feel if I'm like, cutting and I'm like, going in there with like a laparoscope or something. Like if I'm already like this, like I don't know, feel this cool about just holding open something. I can't imagine like how cool it's going to be to like really go in there and, you know, really do a lot of stuff. So yeah, it's a adrenaline rush. And I think that was kind of, you know, compared to that, and I did actually my surgery and OB-GYN, those were like my first two rotations. It was OB-GYN, then surgery. And I did that because I was interested in possibly doing surgery. And I think because I did that first, the other rotations kind of felt more boring to me afterwards because I already got like a taste. I'm like, oh wow, this is like really crazy. Like this, you know, like a lot of cool stuff. And then for me, the other rotations were a lot more like go into patient room, take history, okay, come out, present, go into patient room, take history, come out, present, you know, and I was just like, this is not as fun. I kind of miss the OR. So yeah, it's a fun. I'm glad I got to do it first.
Yeah, no, that I've a friend of mine is doing surgery first, and it's just kind of like it's kind of like from what he's telling me, being thrown into a fire, like
Oh yeah.
pre-clinicals and then just going straight into surgery.
Yeah, I definitely say it's like, you know, it depends on, of course, the preceptor. Some can be nicer, some are more harsh. I mean, surgery does have a reputation kind of. I think it's because like the nature of it, it's a very serious thing, you know, it's like you can't make any mistakes, attention to detail. So I mean, obviously there is the stereotype that surgeons are very serious and, you know, can be jerks and stuff like that. I don't think that it's completely true. I just think that the job is a very high stress, and it's like the nature of it. It's just very high stress and stuff. So you'll definitely learn a lot doing the surgery rotation. You know, just be prepared to, you know, study up on the patients and stuff like that, and have a general idea of the surgeries. You don't have to know how to do it, but just like a general, you know, idea, and you'll probably be fine.
Yeah, that'd be amazing if I could walk in as a third year med student and say, "Oh yeah, I know this whole procedure." Like, no.
Yeah, I'll just do the appendectomy, no problem here. Get out of the way. Yeah, I mean, if you're a gunner, I guess, but
No, I think I'll be fine. um, so what is kind of like the average number of residency applications that you submit? I know you like apply to 3 specialties. Um, so maybe your number is a little bit different. But I know like in general for each specialty, a person might apply like 20 or 30. Maybe that's low. I don't know. Can you give me like the rundown?
yeah, so it definitely depends to like on a few factors, like how competitive do you feel as an applicant? If you're less competitive, you might want to apply more and more broadly. If you're like, I have a 260 and like, you know, like on this and that, like I know for sure, like I'm probably gonna get in, then you might just apply to the main ones that you want to. So I think it's like you can work with your advisor and say like, you know, like how competitive am I actually? And then once you have an idea of how competitive you are, you can kind of gauge that, because obviously applications are expensive. It adds up. I spent a good amount of money on applications because I applied 3 specialties. So it was like, you know, 3 times almost the normal amount that someone would spend. But I'd say in the range of like 30 first for surge or so, 30, 40 maybe.
Gotcha. All right,
Yeah.
thank you. Yeah, because I don't know, I've had like so many of my classmates say like, how many residency applications do I need to like think about? And I'm like, this is first year med like
Yeah.
it seems like so far away, but the first year went by like so quickly. So now I'm realizing, okay, I should
It's
probably
gonna
start
all
thinking
go
about,
by quickly, man. It's gonna
oh
all go.
no.
What's gonna feel like forever. I feel like I've been a med student for like 10 years now, you know, at least. It really does, because like it just feels like you're doing so much condensed and stuff, and it's just like it feels way longer, but then once you finally get there, you're like, whoa, that was like quick. It's like in the moment, it's gonna feel like forever. And then like when you're finally like 4th year about to graduate, you're like, wow, where did the time go?
Yeah, I remember it was October and I moved to DC for med school, and a friend was visiting that I hadn't seen since May. I was like, man, I haven't seen you in like a year. And I was like, no, it was 5 months ago. There's like this
Yeah.
massive time dilation that you get when you're just, spending every day essentially doing the same thing like every week, just studying from like 8 to 8, probably more. So yeah, that time dilation is insane.
Yeah, the sense of time definitely just changes once you go into medical school.
Okay. And so going back to that match day, you dressed up as Zuko. What was
Yeah.
up with that? Is that something MCG does, like they just do that? And why Zuko?
Okay, so we do, so at MCG we do like, you know, themed based match days. So the theme for that one was both Nickelodeon and Disney. And I just happened, like, my hair was pretty long anyway, so I'm like, oh, you know what, like, I actually originally I wanted to do Aang because Aang is my favorite Avatar character, but I was like, okay, I have pretty long hair right now, so I might as well just keep growing it out to see how long it gets so I can do like a Zuko cosplay. And I figured a few other people were going to do Aang anyway, so I was like, you know what, like, I'll just go for Zuko, why not? um yeah, so I think, yeah, I was the only Zuko there, and there was like three different Aangs. So
Yeah, and you
um
found them all, right?
I did. I found all the avatars. So, I regained my honor. Um but yeah, no, match day is a lot of fun because like everyone's dressed up and like everyone's finding out what they're getting into. And for me, it was a very wild one because I actually thought I was probably gonna match anesthesiology, and then I found out I matched general surgery. So it was kind of a life-changing moment for me.
Yeah, it's kind of like Zuko figuring out what his destiny was and not
I,
being what he
I did.
expected it to be.
I found out my destiny that day.
So when do you start your new job?
Yeah, so the process of like transitioning from medical student to residency, I had no idea about it myself as a medical student. So basically what happens is, so you match on like March 18th, right? And then, all of a sudden after the results are released, because apparently I think the programs already know who match before you do. You suddenly get like a ton of emails from your program. They're like, welcome to, this residency. And like, here's a bunch of documents you need to sign. Here's like, your contract. Here's like all these information. So you're just like bombarded with like these emails, right? So you're like, yes, okay, sign contract and stuff. Um, you're gonna get like emails kind of like weekly. We need you to do drug screening. We need you to do like, like background checks. We need you to fill out these papers. It's just like, it's like actually a lot of like onboarding process. They have like, you do like modules, like for my program, like they already had us like do like a bunch of modules to prepare us for like the program. We got access to the ACS, which is like the American College of Surgeons, and like they have like, study modules and stuff. So it's like we already get access to like all that information. And then our orientation will start June 17th. So you get like, a few months before orientation starts. And then the orientation will go until like July 1st, basically. And then July 1st is the first like official day that like you're working.
Mm,
So technically I'm starting my orientation on June 17th. And then it's like 2 weeks of orientation, basically. During that time, we will also like have our white coat ceremony. So we'll get like the long white coat during that time. Um, and
that's
yeah,
gonna be
so
so exciting.
it's gonna be very exciting. I can't wait to kind of ditch the short white coat.
Yeah. Yeah, I didn't realize programs would have like orientation in 2 weeks leading up because I knew like July 1st was like the official, like this is when residencies can start as early as July 1st. But is it like like a full 2 weeks of an 8 hour workday?
I don't think it's a full like 8 hour work day. I also I think it depends on the program too. It might just because it's like general surgery and like there's just like more rules and more things they want us to be ready for before day one. I mean, there's like, meeting. I haven't met any of my residents yet. I haven't met anyone, so I think it's like kind of getting to know each other. And part of the orientation too is like team building type of exercises. I think like we're gonna have like a picnic and stuff, and like family like barbecue or something like that. The white coat ceremony. Oh, and then also during that time we're doing like certifications and stuff. So like we're gonna
Mm,
do like like our basic life supports and like all these like different certifications like that we have to have as like a doctor. Like we're gonna like knock those like all out during orientation.
gotcha. Now that all sounds so exciting. You're just describing like the first few weeks of becoming a resident, and I'm like, a few more years, man. I'll
You'll
be
get
there too.
there.
So what do you plan on doing until then? You've got a few weeks left.
Yeah. It's actually more stressful than you think because you're like, I have a few weeks of freedom. Like, how do I spend it? So, because like you kind of, I don't know, at least me, I'm like really trying to like figure out what I want to do. And I'm like overwhelmed. I'm like, okay, like I need to travel. Like I need to like, but also it's like this is like a great time for me to like work on my YouTube videos because like I don't know if I'll have enough free time. So I'm like, how much do I work versus how much do I relax? Is like that has definitely been something I've been trying to figure out. So I honestly, I don't know. And I'm gonna probably end up spending most of my time like trying to do both and kind of like doing okay at either. I'm gonna go travel a little bit. I have like 2 trips ahead of me, and I've been trying to read a lot of books too because I'm like, this is like my opportunity to like, do a bunch. I have like a big pile of books in my room that I have just not touched for like 4 years of medical school. So I'm like just trying to like knock through books right now. Um, yeah, it's good. It's a good problem to have. I just don't know exactly how to spend my last month.
Yeah, man, editing videos on the beach would sound nice. I don't know if you're going to a beach, but like that would
That
be
could be
like
a
dream.
nice place to edit. Yeah, maybe I
Yeah.
should do that.
What kind of books are you reading?
So I just finished reading Make Your Bed. It's like a book by like a Navy SEAL. He just basically talks to you
Mm.
about like the lessons he learned during his like Navy SEAL training. So that was a book. I think I'm gonna like read books like Atomic Habits, and I like to read a lot of like I guess like the self-help type of books. So
Yeah, I could use
that's
a
kind
lot
of
of
my cup
self-help.
of tea.
Okay. All right. I won't keep you for too much longer. I just have like two more questions for you.
Yeah.
One is going to be what's your biggest tip for pre-meds? And the second one is what's your biggest tip for med students who just finished their first year of medical school?
Okay. I guess we can start with the pre-meds first. I think if there's one tip, it's kind of hard for me with one tip, but um, I think overall, I think pre-med is about your mentality. I think it's about attitude more than anything. I do think that with the right mentality, you can definitely succeed if you really want to. I know a lot of pre-meds do get discouraged, like, like with bad test grades or like, oh, my MCAT score is not high enough, like I'm not going to get in, or my GPA is not good enough, I'm not going to get in. I think one of the biggest things is just to remember that like the application is like multifactorial. So it's like just because one component might be a little bit lacking, you can make up for that with other components. So it's like, extracurriculars, clinical experience, shadowing, research, volunteering, leadership. All these other things do play an actual role. And medical schools don't just care about just the grades. Of course, you have to have a certain level of grade, but you don't need a 3.9. You don't need a 4.0 to get into medical school. And some people feel that way. They're like, oh, I got a bad grade in chemistry, I'm never going to get into medical school. It's like, look, pre-med's already hard enough. You already are stressed enough because it's just a very, long and intense process, right? Don't make it harder for yourself. You know, you can still get into medical school. You have a decent GPA 3.3, you can still get into medical school. You just need to make sure you focus on the other aspects of your application too. Like if you have really good clinical experience, you're a scribe for several years or you're a nurse before or something like that, these things can really help you stand out. So I just say like, maintaining just the right outlook as a pre-med. It is hard, but you still like you have many avenues for success if you're willing to like explore them. And then for someone who just finished first year of medical school, I'd say there's a few different things I would say. Number one, biggest thing for me is don't sacrifice your mental health for anything. I think that's priority number one. I know we want to get into like a really great specialty or we want to do really well in med school, and there's a lot of pressure to do so. But I don't think it's worth like torturing yourself to do that. It's just not. You're gonna end up where you need to end up anyway. Like, just work hard, but like not to a point where you're like killing yourself to do so. I think it's more important that you take care of your own sanity and health and well-being. You're going to end up a doctor anyway, and you're going to probably end up in the specialty that you want to anyway. So don't make the process more painful than it has to be. So that's the first tip. I would say like exercise is a great way to do that because you're taking care of your health too. And we learn a lot as medical students about like the importance of preventative care, and preventing, illness in the future. And exercise is the way to do that. For me, I found exercise helped me to stay sharper during clinic as well. If you take care of your body, take care of your mind too. So that's a big tip for me. Um, and I would also say definitely really explore all of the different specialties as much as you can as soon as possible and really figure out which ones are interesting you the most. My biggest mistake was I found emergency medicine during my first year of medical school and I kind of stuck to it. I was kind of like, oh, like this is so cool. Like I don't even need to like really care about the other specialties because like I know for sure I'm going to do emergency medicine. And I just kind of was like really like gung ho about it. Even though I like the operating room and stuff, I was like already like, well, I know I'm gonna like the ER even more. And I kind of waited till then, and then I got in the ER, and I was like, you know what, I kind of missed the operating room. So I'd say like definitely just be willing to like explore all the options. Take the time, you know, if you get a weekend off, go shadow a doctor in a specialty that you're interested in, and kind of knock it off the list or really bump it up the list. You know, you don't want to wait until, you know, fourth year to realize like, oh, I really wish I put more time into this, or like I got a letter of rec from this person. The sooner you figure it out, it's going to save you a ton of like, you know, trouble and headaches down the road. So that would be my biggest tip for someone who's just like starting medical school.
Okay, thank you. That was a lot of advice, and I think it'll be really helpful for like all the people watching this right now. So I really I'm grateful for the time you took to talk with me today.
Yeah, no, thank you for having me on here, though.
Yeah, of course. All right. Well, thank you for watching, and I think I can include like your contact information in the description, like all of your socials and all your plugs and stuff. So if you want to follow Dr. Caruso for any questions or just watching his funny and relatable content, feel free to give him a like or a follow.
Yeah, thank you. I appreciate it.
Yeah, thanks everyone.